Sorry, I don't know how to make that camera turn on from my phone here, but there is a way to do it. My wife was trying to show me how, and I guess I'm pretty illiterate when it comes to tech stuff. At any rate, I want to discuss testosterone today and the importance that testosterone is playing right now in many people's lives, and probably should be in many more of us than it already is. I apologize, I have a bit of a cold, so my nose is running all day long today. So if I have to stop and blow my nose, please overlook that for me. First of all, I want to give a shout out to Ageless Men's Health. If you have any suspicion that your testosterone is low, these are great guys to talk to. Their program is expensive, but they're spot on the way they treat men and women with testosterone therapy. And if you can afford them, I highly recommend them. They are very, very cautious. However, you don't have to do it that way. If you choose not to, you can. There are other ways to go about getting your testosterone levels up to where they should be. And I want to discuss, anyway, a lot of stuff. I'm sure I'm going to leave stuff out because it's actually a pretty broad topic, but I'll talk about it a little bit. So I'm going to go over some of the symptoms. I'm drinking a cup of tea here in between with some honey and lemon to hopefully make me feel better. At any rate, these issues are far more widespread than we tend to realize, and that's what I want to discuss. It's not just about sex drive and erections, though that is a big part of it. That's not the only part of it. But when you're feeling healthy, when your body is healthy and functioning properly, your sex drive and erections for men will be where they should be. I'm not saying that you're going to be, have a super high sex drive or anything like that. Not like a bull out in the field during mating season or anything like that. It just is a healthy sex drive. And the same thing is true for women. You will have a healthier sex drive when your body is healthy, well-fed, has the proper nutrition, and has the proper testosterone levels. So let's spend a few minutes and talk about some of the other issues that have to do with testosterone. I've got a list here in front of me on my computer that I'll be referring to so that I don't forget things, and I'm sure there's still some things that I'm going to leave out. But I want you to understand that it's not just about sex drive. It's not just about building muscle, though muscle tone, muscle density, the size of your muscles is affected by your testosterone levels. That isn't just what we're talking about. So other things that it affects is your focus, your ability to focus on a conversation, on a task, on a project, while you're at work, while you're at home, while you're driving. Testosterone affects those things and greatly improves it. Your tolerance of others. Some people are afraid of what's known as roid rage, which we've heard so much about because of the abuse of testosterone in the sports world. And that is real. Testosterone, when your levels get too high, it does make you edgy. It makes you a little irritable. But the truth is, if you're a good guy and your testosterones are normal, you're not going to feel those effects. You're just going to feel good. As a matter of fact, I think your tolerance of others improves. If somebody cuts you off on the freeway, you're more likely to say, hey dude, that's okay. Just, go ahead and pull in. Rather than honking your horn and getting mad at them or flipping them off or something like that. That's actually less likely to happen when your testosterone levels are at a level that they should be. Your ambition to get things done, to be active, to be proactive, to be, I don't want to say attacking life, but living life, and living life to what would be your maximum. Testosterone affects that. When your testosterones are low, you feel more lethargic. You feel less ambitious to get things done. Sleep, just your ability to fall asleep and your ability to wake up are both affected by testosterone. You'll actually sleep better and feel more rested in the morning if your testosterone levels are up to where they should be. Your ability to wake up in the morning and feel energized and ready to go and live your day, live your life, do the things that you need to do or want to do during the day are more likely to be accomplished. You're more likely to do these things with your testosterone levels where they should be. Depression is definitely affected. If you're under treatment for depression or anxiety or both, really depression and anxiety are two sides of the same coin, but if you're already under treatment for those, I would say it's nutty to not get your testosterone level checked, because it can correct those problems often, not just sometimes, but often. And it's certainly a better, more natural, healthier way to correct depression and anxiety. Your drive, and I know that kind of goes back to your ambition, but your drive to get things done. I remember when I first started working for Ageless Men's Health, I used to ask the guys, well, what has it done for you? What do you feel? And I'll never forget one guy who said to me, "Oh, Whitney," he says, I wouldn't get off the couch to get myself a beer. He says, if the remote wasn't in my hand, I wouldn't change the channel on the TV. And he said, now, a few months down the road, I'm actually running an online business. I come home from work and I go to work on my online business. I'm doing things around the house. I'm getting those things done that make me feel good about myself, that improve my self-esteem. So your drive for life is improved. Mood or moodiness. Men with low testosterone and women with low testosterone tend to be moody. I know there's a difference there in the sexes, and women are definitely moodier than men, but men can be pretty darn moody too. And when your testosterone levels are up to snuff, you are less likely to be moody. Your mood is more upbeat and more of an attitude, let's figure it out and get this done, instead of being depressed or upset about things. Here's a big one: weight and weight control. So, obviously as you build muscle, everybody knows this, as you build muscle, you're burning more calories because muscle burns more calories than fat does. So while you're on the testosterone, your body is building muscle, and it's not just building muscle, it's the density of your muscles. Your muscles actually become more flexible, stronger, more agile, and that in turn helps you to burn off the calories that you're taking in. In addition to that, because these other things that we were talking about up here, your mood, your drive, your sleep, it just changes who you are. Sorry, I'm fishing for words here. But your weight control, your ability to control your weight, your desire is more enhanced, and you're able to eat better. That's very elusive, but it's also very true. You'll find that you'll be doing things that you've always wanted to do. Your focus on the job, again, your ability to stay on, and that has to do with also with losing weight and going to the gym, getting out and getting the exercises that you want to do, whether it's running or walking or lifting weights or whatever your thing is in staying healthy. This is going to help you focus on those tasks. You'll become more focused at work. If you're an engineer or something like that, you'll be spot on. You'll be paying attention to the things that you want to accomplish. Your alertness in conversations. When somebody's speaking to you, your mind will be more focused on what is being said to you. You'll listen to them with more intent. Muscle strength and density. I talked about that already, but obviously that will be enhanced. And I don't approve of or encourage people to get their testosterone levels over 1,000. I think that they should be below 1,000 or banging right up against 1,000, maybe to 1,200, but certainly not bodybuilding or sports enhancing type dosages where their levels are probably 3,000 to 5,000, and that's inappropriate. And you don't feel good at those levels. You actually become kind of edgy and jittery, and it's not a good feeling. keeping them down to where they should be, that's 700 to 1,000, 600 to 1,000, somewhere in there is actually a really good level. You will build muscle more easily. If you want to run, your endurance is going to increase. If you're a cycler, your endurance is going to increase. Here's a difficult one to pinpoint, but insight. Your ability to figure things out is actually increased. You don't feel muddled. You don't feel confused at things that cause you to concentrate. Obviously, with all this, your self-esteem goes up, but just having the testosterone on board automatically increases your self-esteem. It gives you that kind of that, I don't want to say aggression, but I'm looking for a better word than aggression. But it gives you sort of an attitude, a can-do attitude. That would be better. It gives you a can-do attitude. We can figure this out. We can make this happen. We can get it to work. And that's the attitude that testosterone gives you. People don't know this, but low testosterone levels causes back pain. A lot of people don't know that. A lot of doctors don't know that. If you haven't studied it, it's a little elusive. But having a low testosterone level, especially for younger adults, can cause chronic back pain, just back aching all the time. Obviously, so can a bad back. So let's talk a little bit more about it. If you go into your doctor and say, I'd like to have my testosterone level checked, and he pulls up the lab slip is going to have your number on it, and it's going to have a low and a high. And you look at any lab slip today, this is such an issue for me. You look at any lab slip today, and they'll go down, I've seen them as low as 150 for a normal testosterone level. But they'll say 150 to 900. And I'm thinking, well, who the heck wants to be 150 if I can be 900 and be normal? And really 150 is just not normal. What I learned working in the field of testosterone, which I did exclusively for a year, 8 hours a day, 5 days a week for an entire year, I learned that men's testosterone levels of 700 to 800, I expand it a little bit and say 600 to 1,000. That's where men feel good. Women, it's like a tenth of that. Women want to be something like 60 to 100. Still, and women's labs, geez, they'll go down as low as 10 on their testosterone and say that that's normal. And it's just absurd. It is not normal. Now, but because of that, because the lab says this is normal, it's difficult to get it paid for. They'll always say, well, we want to check your testosterone before 10 o'clock in the morning, or we don't count it as real. The reason your insurance company says that is because that's when your testosterone is the highest. Early in the morning is when you peak on testosterone, and then it fades throughout the day. So they make you check it early in the morning in hopes that you'll be whatever the lab's cutoff is, that you'll be above 200 or 250, and then they'll say, see, you're normal. So no, we're not going to pay for your testosterone. Men and women, I'm going to say, pay for it yourself. Don't go with your insurance company. Don't even try. It's not that expensive to do this for yourself, and the results are phenomenal. You will feel fantastic. It's not like taking a hit of a drug or something like that winds you up and keeps you awake for days or something like that. It's a subtlety, but it's more like, I just feel better. I just like the way I feel on this, and I like me better with my testosterone levels up to where they should be. So again, you want your testosterone level, I'm going to say somewhere between 600 to 1,000, and that is a trough. So when you give yourself a shot of testosterone, or when your provider gives you a shot of testosterone, you check it in a week. You check it at the 7-day mark, and then you usually should get another shot of testosterone. On that 7-day mark, it fades over the entire week. So you get it, it peaks in about, it varies, 18 to 36 hours. Your testosterone level will peak after that injection. And then at a week, you want your testosterone level to be about 600 to 1,000. That means that you're going up to 12, 13, 1,400 during the week. That's okay. But you don't want that trough, that lowest point, to drop below 600. If it drops below 600, you start feeling kind of punky again. You'll understand this when you start your injections, that you, especially when you first start them, till you get those levels up to where they need to be, you'll find that towards the end of the week, the first few days you feel great, and then the next few days you feel kind of like, I'm just dragging again. And that's because it takes a while to build it up in the body. But after 3 or 4 or 5 injections, it starts to stay up to where it should be. It'll still fluctuate, and that's why this idea of getting shots, a lot of doctors will do it once a month, once every 2 weeks, once every 3 weeks. That it's not sufficient. It just, you can't have good testosterone levels without getting an injection at least once a week. Some people actually have to go to twice a week. That's rare, but it does happen. So, sorry, I'm giving you a lot of information here. I would say watch it again, take notes. But you want your testosterone checked right when your shot is due, and you really want to give yourself a shot or get a shot from a provider once a week. And that will keep your testosterone levels where they need to be and not allowing them to drop below 600. What I noticed, some people will say, oh, there's only about 40, 50, 60% of the men that need testosterone. I think it's closer to 90% if you're over 28 years of age. And I'm serious about that. Men's testosterone levels, for some reason, are dropping and dropping and dropping. I don't know where that's coming from. I don't know if it's in the air, if it's in the water, if it's in the food, but something is causing our testosterone levels to drop. When we're in our early 20s, our testosterone levels are banging up probably around 1,500 or higher when they're at their peaks. And you think about that crowd, that group of young men from 16 to 25, and who are those guys? Who are these people, if you were going to describe them? I always describe them as, these are the kids that'll take their skateboard up on the roof, ride it down the roof, jump off the trampoline, and try to bounce into the neighbor's pool over the fence. That's the kind of zest you want for life. I'm not saying we want broken bones and broken heads from all of our 40-year-old men, but we want you to have a zeal for life, that you can go out and you can get it done. That life means something to you, and that you're not just dragging your butt to work at 8 o'clock in the morning and then coming home and sitting on the couch and watching TV. We want you to have a zeal and a zest for life, and that's what testosterone will give you back. Other things that you need to be aware of, and I may make another video on this, but maybe you'll get enough off of this and you can talk to your doctor about it, or if you can, go see Ageless Men's Health. They're the experts. Nobody beats them on this. But you also need to be on a medication, most likely need to be on a medication called ANA, anastrozole. Anastrozole blocks the conversion of testosterone to estrogen. So a lot of men don't know this, a lot of doctors don't know this. Testosterone automatically converts to estrogen in the body. Not all of it, but some of it. And that's actually a good thing. You want some of your testosterone converting to estrogen. But you want your estrogen to be 25 to 35, somewhere in that area. If it gets too high, you get moody, you get geeky. You start to get like a woman before she's going to be on her period. You actually get premenstrual almost. If it gets too low, it gets harder to have erections. So you want your testosterone level your estrogen level between 25 and 35. But you have to stop that conversion. That conversion is called aromatization. And you don't want too much of it to aromatize. Now, if you don't need ANA, the anastrozole, and your levels are staying at 25 to 35, great. But most men need a very tiny dose. It's about 1/4 of a milligram a week is all it takes. It's a little tiny chip of a pill to keep the estrogen levels where they should be. The other thing you really should do is use HCG. You probably remember the term HCG from about, 10 years ago. It was all the rage for a diet. There were HCG clinics starting up. They're probably still out there. HCG stands for human chorionic gonadotropin. This is the hormone level that they check in women to see if they're pregnant. When you go into the doctor's office to see if you're pregnant, they check an HCG level on you. HCG is a very common hormone. We all have it. But what HCG does in men is that it tells the testicles to keep working. So when you go on exogenous testosterone, when you go on injections of testosterone, or creams or gels, which I'll talk about those sometime. I don't really like creams or gels. I don't think they do the job. But when you go on a course of testosterone, your testicles are told, hey, you don't need to work. You can go to sleep because we got plenty of testosterone in the body. Well, that's okay if you never want to go off of testosterone. But if you're ever going to want to go off of testosterone, you want your testicles to keep working. And they can shut down and never bounce back again. That actually happens to some guys. The other thing that happens when you go on the shots of testosterone is that it actually shrinks your testicles and makes them softer. So just from an aesthetic thing, I know for me, I want my boys. I want them normal. You know, I even though I'm 64 years old now, I'm not going to have babies or anything anymore. I want my testicles to be functioning normal. So I use the HCG. I use a small dose every week. It doesn't take very much, 1/4 of a cc of HCG, a little tiny injection is all it takes to keep your testicles working and functioning. Some guys go on a little larger dose, like at the end of the month or something like that, or even after 2 months, and just they'll go off the testosterone and just tell their testicles to kick in and start working. That's an okay treatment. I can't disagree with that. I think it works. I just prefer to use a small dose every week. It's a little tiny needle, so I don't mind injecting myself with it. And you can decide that between you and your doctor when you go to see him. Next thing is the needle size. So this one's important. I've had people come in saying they're on testosterone and they pull out this 18 gauge needle. That hurts like an SOB. You don't want to inject yourself with an 18 gauge needle. That's hard to do. That hurts bad. If you can get it, what you want is a multi-dose vial of testosterone, which means you get 10 cc's of testosterone in a vial. It comes larger than that, but it's hard to get it from pharmacies anymore because they're afraid you're going to abuse it. So they usually give it in a one-time injection of 1 cc. And you can inject that with as little as a 25 gauge needle and a 1 cc syringe. You don't want these 3 cc syringes. You want a 1 cc syringe. The reason you want that is because there's a lot more pressure behind the plunger on a 1 cc syringe. It's much easier to give. Testosterone comes mixed in oil, and the oil makes it a little bit difficult to push through the needle. So you want that 1 cc syringe so that you can inject it into your leg or into your butt a lot more easily. I'm thinking I'm leaving something out there and I can't remember what it is. Oh, probably just the average dose. Average dose to keep a man up to 600 to 1,000 is about 0.75 cc's, 3/4 of a cc. That's at 200 milligrams per cc. So you're going to get about 150 milligrams. Some guys need way less. Some guys only need 40 milligrams a week to keep their testosterone levels up. And then there are some guys who need that 200, 230, 240 milligrams a week. Those are not common. Most guys do fine with less than a cc a week. So it's a tiny injection. It really just doesn't take much to get your testosterone level up. Now let me talk about the number of men who are low. This, what to me was astounding and actually a little bit frightening. It was every guy that came into our clinic, I would guess somewhere in the neighborhood of 90-95% of them were low. They all had low testosterone. It was amazing to me. You'll hear numbers. Let me see if I can close this a little bit. Sorry. You'll hear numbers of 40-50% or something like that. It's just not true. The numbers are very, very high. I don't know why that is. I think that needs to be investigated and figured out why are so many guys, I'm going to move out of that light, sorry. Why are so many men low? But I can tell you from personal experience, but not just my personal experience from me, but personal experience of injecting 250 guys a week, everybody does good. Now, most men, when they come in, we would hand them a questionnaire, they'd fill it out, and then we'd sit down and all of them are saying, oh, no, I don't have any trouble getting erections. That's not an issue for me. I get that, guys. I get that this isn't something you want to talk about. but we were very open about sex life, about erections and stuff like that. It's a part of health. So I say, let's just talk about it. Put that down. They would come in after one shot. At the second week, they would come in grinning and saying, oh yeah, it's better. And my wife says, thanks. You know, it's a part of life. You know, let's be adults here, and hopefully there aren't kids on here goofing around watching this thing. I hope it's for adults. But your ability to get erections is going to improve, and all of these other things. Your life is going to improve. Your life is going to feel better. So my recommendation is, please get yourself checked out. It doesn't take a lot to go to a doctor and find out what your testosterone level is. And if it comes back certainly below 500, you should go on treatment. You should at least try it and see where you get with it. In our practice, what we did was, if they were 200 to 400, no questions asked. You don't need to do any more checking. You don't need to look at things. You just need to get them started. And all of those men would do better. But we would often see guys who were 500, 600, and then you have to start checking free testosterone levels. And you want that free testosterone level to be up, I'll say 14 to 20. You want your free testosterone level to be up to where it's useful to you. And that's the testosterone that your body can actually grab a hold of and use. But checking a total testosterone level is sufficient for almost everybody. Anyway, thanks for listening to me drone on. If you have questions, you can post them here, and I will try to answer them in a timely manner. And now I'm going to get up and turn this video off because I don't know how to do it from my phone. Anyway, thanks for listening and have a great day.